For the immersion technique, you need the immersion shell, extension sets, and BSS. For supplies, please contact your Accutome representative. Connect the extension sets and BSS to the immersion shell. It is important to note that if the probe is too close to the patient's eye, it will shorten your axial length. Please align the probe with the etched line on the immersion shell. When reclining the patient, ensure the horizontal plane of the patient's face is parallel with the floor, making subtle adjustments by having the patient raise or lower their chin. Also make sure the patient's head is straight and not turned to one side or the other. When anesthetizing the patient, place a drop on the upper and lower lid. Also anesthetize the fellow eye to help with fixation. If patient has tight fissures or is squeezing tightly, have them look down towards their toes. This will relax the upper lid muscles and allow for a better grip. Using the tip of your thumb, pull back on the patient's top lid and pull the bottom lid down with the index finger. Insert shell under upper lid first. Have the patient look towards the ceiling, then insert shell under the bottom lid. Once the shell is in the patient's eye, switch hands so that the hand resting on the face is holding the shell. Once the shell is in the patient's eye, make sure the patient's fellow eye is fixated on an object directly above their head. Fill the shell with BSS until the solution reaches the probe tip and a recognizable wave pattern appears on the screen. Holding down the foot switch will allow you to analyze your scans before capturing. Once you release the foot pedal, the A-scan will capture automatically once the minimum criteria is met. You can also review your scans using the foot pedal to ensure proper alignment and good wave patterns. For any questions on immersion, contact Accutome's ultrasound department. You can also order immersion supplies online at www.accutome.com.